Welcome to Voices for a Healthy Legacy, where we discuss health and wellness with relatable medical professionals. I am your host, Dr. Andrea, and today's guest is soon to be Dr. Shatoya
Yes.
Brown. Welcome to the show.
Thank you.
All right, so tell us a little bit about yourself and how you became passionate about mental health.
Well, again, my name is Shatoya Brown, and I am from Demopolis, Alabama. And I think my interest in mental health is something that has just grown over the years. As a child, I always knew that I was interested in science and helping people. So my one of my first career paths was being a teacher, a biology teacher. And there I saw that there were so many other aspects involved in students and their ability to learn. And in that environment, I was able to see all of the different barriers that kind of prevented them from being able to be their best. And so I kind of wanted to do more. I wanted to do more to help students and children be able to be the best versions of themselves. And so I decided to go into my second career, which was school psychology, where I could help students kind of get through some of those mental health issues and barriers that prevent them from being their best selves.
Okay, awesome. So it seems like there's been an uptick in mental health conversations. So will you kind of define what mental health means to you so that people will kind of have a better idea of what we mean when we say mental health?
Okay. So yes, mental health is a term. It's like a broad term that we hear all the time. But mental health includes ways that you're impacted socially or psychologically or emotionally. So I like to think about it as factors that affect the way you think, the way you feel, the way you react, or the way you act out in different environments.
Okay, awesome. And your experience, you deal mostly with children, and
Yes.
You express your passion for kind of catching kids at an earlier age to help them become a better adult. Are there some mental health issues or illnesses that you see in adults that appear to present differently in children? Like, let's say depression or anxiety. Do those sometimes present differently in children versus adults?
Okay, that was a good question. And sometimes, yes, but more times than not, I've seen symptoms that were very similar.
Okay.
I really feel that it's more so our community and our society, we don't expect to observe mental health issues in younger students or younger children. So we tend to overlook those symptoms, but oftentimes they're very similar.
Okay.
Like I've seen anxiety in students or children as young as 4 years old.
Wow.
And they experience some of the exact same symptoms that you would as an adult. You could see like changes like in their behavior or changes in their sleeping pattern or them wanting to avoid certain places or situations. And those are some symptoms that you see in adults. Adults may not want to eat, or they may overeat, or their sleeping patterns may change abruptly. They may stay in bed all day, or they may not be able to sleep at all. So there are some symptoms that are different, but more times than not, they're very similar. It's just that I feel like we don't look for them in children, especially younger children, because we don't expect that they'll be experiencing some of the same mental health issues that we do as adults.
So it's interesting that you brought up like even as young as 4 years old, having like anxiety. So I've had a 4-year-old before. You've had a 4-year-old before as well. So how do we kind of know it's anxiety versus your typical, now I'm 4, I have more personality, and I'm trying to just kind of figure out the world. And, for them, their biggest obstacle may be, I can't find my favorite toy. So how would we kind of distinguish whether it's anxiety or what we would consider to be typical 4-year-old behavior?
Just being observant of your child or children that you're around very often. Typically, we know what their normal behavior looks like. And when we start to notice different trends or different patterns where they seem to be nervous about a certain situation or just hesitant to approach a certain situation, then I think that that's like a good indication that there may be some anxiety there.
Okay.
So just paying attention to different patterns. And sometimes we'll see the worry or the anxiety, but not initially know what preceded that.
Okay.
So just being observing the behavior and then kind of looking at what may be causing that to happen.
Okay. Excellent. So, what is one of the biggest mental health challenges that you see in children, and what do you think may be the root cause of that?
I think the biggest mental health challenges that I have seen, especially lately, would be anxiety and depression.
Okay.
Depression, just extended periods of sadness. We all go through times where we're feeling kind of down and not ourselves. But when that extends to 2 weeks or 3 weeks or longer, and you're not able to kind of pick yourself back up, then that's what we consider to be depression. And I see that a lot with children as well as anxiety. Just generalized anxiety, just their fear of, typical day-to-day situations and worrying about situations that are upcoming.
Okay.
Or children being worried about, what will happen in different social environments. So like that social anxiety. I feel like what has contributed to the increase in anxiety and depression is just children and students being able to have access to so many things and being able to see so many things. And they oftentimes compare themselves to other people. And when they feel like, they should be acting a certain way or saying things a certain way, and they don't feel like they are, adding up or as adequate as other people, then they compare themselves to other people, and that seems to cause some anxiety. And then just not having, I feel like, the coping skills to handle situations, because we know that they're going to be difficult situations. Right. But just making sure that they have the tools to handle those situations prior to them happening.
So just listening at you talk about children and depression and anxiety, would you say it's a true statement for the most part? And I know everybody's situation is a little bit different. When you think about feeling low, depressed mood, is it because you're reflecting more on what has happened and you're kind of being stuck in that place, versus anxiety, you're worrying and you're fearful because you're thinking of the what if or what's to come in the future, because you're not there and you're just constantly thinking about that part?
Yes, I think that's a great way to put that.
Okay.
So anxiety is typically just nervousness or concern about what's to come. And on the other hand, we tend to become depressed based on what has already happened.
Okay.
So I think that's an excellent way to describe the difference between the two.
Okay. All right. So in recent years, just kind of taking a turn, recent years, we've been hearing more about bullying. And I'm sure when we were younger, bullying was a thing, but people didn't really pay attention to it. And like you were saying before, having the coping skills and knowing that you can reach out and kind of what next steps to take, we don't know how much of that could have possibly been eliminated in the past. So there's much more awareness around bullying. What are your thoughts on why do you think that's more of a thing now versus what we've had in the past? And like, what are some signs? How do we recognize it? Different things, compared to, maybe times in the past.
Okay. Well, bullying is just it's the act of when someone is making another person feel uncomfortable, or even to the extreme where there's some sort of physical contact. I do feel that bullying has always been prevalent, of course. I experienced bullying as a student, as a child growing up. And I've seen students experience bullying in the school environment now, currently. Typically, students know when they're being bullied because it goes beyond just the normal, teasing or horseplaying. They can sense when someone is intentionally trying to make them feel uncomfortable or sad or feel bad about something that's different about them than everyone else. And so what we encourage the students to do is to speak to someone about it. Speak to a peer about it, speak to adults about it, because when you speak to your peers about it, they can kind of comfort you. It's strength in numbers, so to speak.
Right.
So when you have a group of people versus a bully, then that kind of outnumbers the bully, and sometimes the bully doesn't even want other people to know that they are the bully.
Right.
And so that'll kind of help. And then, of course, you always have the adults that are there to kind of intervene if the peer isn't able to provide the support that's needed.
Right.
But I would also say, as like adults and parents, I think it's important to just provide your children with affirmations. Because we know that the bullying is likely to occur. But if you have provided affirmations to your child from like a young age and just affirming them that you are smart and you are handsome and you are pretty, or even if there is something different about them than the typical kid, just to let them know that, yes, this is different about you, but we all have things that are different about us. And so when they go into the world or into a school environment, when they hear someone saying something to them, they'll already know, well, that's not true about me.
Right.
Because my mom has already told me something different. And so although they may hear it and it may impact them to a certain degree, it may not impact them as much as a student that did not have that affirmation before entering that environment.
That's a wonderful, wonderful answer. Having said that, I'll use myself for example. So when I was younger, I used to get made, like kids used to make fun of my lips. Like, oh, your lips are so big. Oh, you've got bubble lips. But guess what? Lips are so in now.
Yes.
And for me, they've always been in. I never had a problem with my lips. But like you said, I knew what I had to offer, and my parents were there to always lift me up, even from a small child. So that does help. So when people would make fun of my lips, I'm like, what's wrong with you?
Yeah, but what do you mean?
I'm like, what do you mean? Why are you calling out my lips? Like, my lips are just fine. So I think having that mental support, which we may not even think about it at that time, from our parents or just whoever is around, so that when you are hit with those hard things from the world, you'll kind of reflect and be like, wait a minute.
Yes.
That's not true.
Absolutely. And I mean, believe it or not, like bullying doesn't stop at high school. It can happen
Talk about that.
through college into adulthood. I mean, you would think that it would be something that you would only experience as an adolescent, but that's totally not true. I mean, it happens to even adults. So it's really good to have those things instilled in you at a young age, because it doesn't stop when you hit 18,
right,
or it doesn't stop when you hit 21. I mean, even adults experience bullying. And so I just feel like when you prepare your children for it, then they're just able to deal with those difficult situations, because we all know that they're going to come eventually.
So how would someone know when it's time to seek therapy, and how do you vet a therapist? Because, you talked about anxiety, depression, bullying, all of these things. At what point should a person say, okay, it's time for me to seek help?
I feel like it's time to seek help when you notice that your behavior is impacting your day-to-day function and your day-to-day life and the things that you need to accomplish. So if you're no longer able to do the things that you typically are able to do, I think that's a very good sign that you probably need some help with working through whatever your issues are. I think, and even for myself, when I see myself getting into a little slump, I can see my behaviors change. I'm not as concerned about things that I'm typically like really particular about. And then I just say, okay, Shatoya, let's do some things to help you feel better. So, I'll do different things, relaxation methods, even something as simple as lighting a candle or reading a book, or just making sure that you have some time for yourself each day. And I know that can be hard, as adults, that can be hard, even as children. We think that children don't have any responsibility. You're like, what are you worried about? You don't have to pay any bills. You don't have a job. But in their world, their issues are just as serious as ours. And they still have a lot of stress and a lot of different things that they have to experience from day to day. So even teaching your children, like, okay, your day is really busy. I know you have school and you have practice and you have homework, but make sure you take out some time for yourself. Make sure you give yourself, 5 minutes, 10 minutes, 30 minutes, sometime each day just for yourself. But when you see that those things aren't helping you, like the typical things you would do to kind of help yourself bounce back, then maybe that might be the point where you need to speak with your parent, speak with your counselor at school, speak with your school psychologist or your social worker and ask for some help.
Gotcha.
I think a good starting point for even, vetting a psychologist or a psychiatrist is kind of, what are your personal goals? Are you looking for medication, or are you looking for just therapy? If you are looking for medication, then you may want to inquire about a psychiatrist. If you're seeking therapy, then you have other avenues that you can take. I think a good starting point, especially with children, would be to speak to your parent or your teacher or your school counselor. Because typically, teachers and school counselors especially can refer you to someone that can help you, because these are professionals that have dealt with these situations before. So I think that's always a good starting point.
All right. So since you brought up, seeing a psychologist versus a psychiatrist, some people kind of get those a little bit mixed up. So can you briefly just give us a brief description of how they differ?
Okay. Well, a psychiatrist would be a medical professional that can provide prescriptions and medications along with different medical diagnoses. A psychologist, on the other hand, does not provide medication. They treat mental health issues through different therapeutic practices. So if you feel that you need a combination of medicine, as well as therapeutic practices, then a psychiatrist may be the route for you to take. If you feel as if the therapy would be sufficient, then a psychologist may be the preferred medical professional.
Okay. Do they sometimes work together, where you can have a psychiatrist who prescribes your medicine, who may have a specific psychologist that they want to refer you to kind of have a dual role in improving your mental health?
Absolutely.
Okay.
Yes.
All right.
Yes.
Awesome.
And as a psychologist, particularly a school psychologist, which is the field that I'm in, we do therapies, but we also do a lot of psychoeducational testing.
Okay.
What
does that look like?
So that involves things that include like ADHD, or evaluations to look at possible characteristics of autism. We also complete testing that involve anxiety or any type of learning issues. So if a student is struggling with learning in school, whether it be reading or writing or math, we are involved in all of those different aspects. So generally speaking, my teacher gave us this assignment. It's called an elevator chat. Okay. So if I had to describe school psychology just quickly in the elevator, I would say that our goal is just to help students with whatever barriers that prevent them from being able to learn, which of course include those mental health issues.
I love it. I love it. Okay, so let's say someone doesn't have insurance, but they still need some type of mental health support, or if they just want to say, hey, I've heard you say all these things, you know, maybe I do need to get an opinion on what I'm dealing with or get some coping skills. So, and they may say, well, oh, I don't have insurance. I've heard that it's very expensive. What are some resources out there for someone like that? So, you know, because I feel like, yes, insurance is good, but if you don't have insurance, that doesn't mean that you still don't need the services.
We kind of hit on this a little earlier, but I think that a very good place to start, especially for students who are still in school, would be to reach out to their school counselor or school psychologist, because those are professionals who can help with whatever mental health concerns that you're experiencing. The school districts typically also have social workers, and they also contract with other mental health professionals outside of the school district who service different students in the community. Okay. So a lot of those services will not require a student to have insurance because they can be provided through the school district. Mental health professionals also, of course, allow you to pay out of pocket, and most will also aid you with different payment plans if you don't have the money to finance it up front.
Okay.
And even if you're a working professional, sometimes your job may provide mental health services that you may not even know about, because you just have to kind of reach out and see what's out there.
Okay.
So I would always say start there first, see what's available at no cost to you. But there are also a lot of resources online that you can seek out to kind of help you cope with whatever you have that's going on at that time. So, you know, do your research online, you know, if you don't feel comfortable, because sometimes we don't always feel comfortable speaking with someone.
Right.
You know, for a lot of people, that's very taboo to sit down with somebody and kind of just tell them everything that's wrong with you, or everything that's going on, or everything that's happened to you in your life or in your past. Sometimes you kind of want to see if you can work through it on your own. So seek out those resources online to see what things that you can do from there.
And I've also just, you know, thinking about online resources, there are some licensed mental health professionals, psychologists, psychiatrists, social workers that I've seen that have presence on like different social media platforms that are pretty reputable. So that way you're getting someone who they care enough to put out this free information, but they also have the expertise to give you some tips that may even lead you to some additional resources. Yes. So I've seen that as well.
Yes. And I feel like post-COVID, there are a lot of telehealth therapists now. So for the individual that may not be comfortable sitting face-to-face to someone, having the option to, you know, have that virtual therapy meeting where you can be in your own safe space, in your own home where you feel comfortable, and having that virtual therapy with your therapist, you know, that may be a good starting point for someone who's not quite ready to sit down with someone face to face.
Excellent. Well, thank you for all the valuable information you have provided thus far regarding mental health. And I really, really hope this answers some questions that some people may have had, and also gives them some direction on where to go with seeking mental health support. So if you could leave them with one piece of advice when it comes to mental health and building a healthy legacy, because we have all the voices that we speak to that are here for that. So you're one of those voices. So what piece of advice would you leave for them concerning mental health and building a healthy legacy for generations to come?
I like to remind students and children that it's always about balance. You want to make sure that you live a balanced lifestyle. So, as children get older, they tend to want to have like a lot of fun and maybe not focus on other things that they should prioritize. But it's always a balance. So you don't want to just have so much fun and no focus. Or even vice versa. You don't want to just be so stressed out and focused on maybe your academic concerns and you don't get to enjoy yourself. So I think a good thing or a good takeaway would be to always have balance. Like, that there are going to be some days where you're going to have to work really, really hard.
Mm-hmm.
But you have to also balance that with at least some moments where you have a chance to relax and unwind. Because if you just stay in that thought pattern of I have to work, I have to get this done, then eventually you could become overwhelmed and burned out.
Mm-hmm.
And when you get to that point, that's when you start to see some of those mental health issues such as depression. And it's harder to kind of dig yourself out of that if you've been putting that type of pressure on yourself for such a long time. So I think it's just always good to remember to try to have balance in your life. And whatever you do, you don't want it to be either extreme. You want it to be somewhere in the middle to kind of keep your mental health where it needs to be.
So people wanted to reach out to you, just to learn about what's to come or maybe direction on how to maybe get an appointment with you. I know you serve primarily children, right?
Yes.
What's kind of the age range that you serve?
Anywhere from pre-K through college.
Through college.
So 3 to 4 up through 21, 22.
Okay. Awesome. Because I'm sure there are so many people who are going to hear this and say, man, I need to talk to her. So how would they be able to reach out to you to get more information regarding an appointment with you and possibly seeing you or someone else that you feel like would be a good fit for them in the future?
Well, I can be reached via email at shatoyabrown13@gmail.com.
Thank you for tuning in to another episode of Voices for a Healthy Legacy. We'll see you at the next episode.